So let's take you to Nakuru, where Ibrahim Karanja is standing by to give us an update on what's going on in that county. And remember, there was a little bit of concern in Nakuru as COVID numbers soared. So Ibrahim Karanja, good morning. Looks like you're not having an easy time at that public health facility. Kindly bring us up to date in terms of, what patients are saying and whether the health workers, nurses are on strike.
Well, good morning, Brenda. Indeed, it is not easy here at the Nakuru County Referral Hospital, formerly known as the Rift Valley Provincial General Hospital. And this is because a few minutes ago we got here to just assess the situation. And as we were waiting to go on air, an official from from this facility, that is this medical superintendent, who I have with me, I'll also be giving him a chance to talk to us, wanted to understand what the media was doing here, and the public, the patients who are understandably worked up because of not having received any services, felt like the media was being threatened, and there was a little bit of shouting here and there, trying to shut down the medical superintendent. However, that's besides the point. The situation in Nakuru is as is across the country. Nurses and clinical officers have downed their tools. I am, like I said, at the Nakuru County Referral Hospital. Let me just give you a brief picture of how it looks like. The people around me are patients who have been here looking for services. They say from 6 a.m. they have not been able to be attended to. I am told by the officers from the Kenya Union of Clinical Officers, Ben Arama, who is the branch secretary here, that only emergencies are being handled. Remember, this facility is the biggest in the region and not only serves the citizens of Nakuru, but also people who come from as far as Samburu County, Narok County, Baringo, and other counties within the South Rift region. And now, it serves about 2,000 patients in the outpatient department daily. Patients who you can see around here. And the inpatient department, I'm told, has at least, when the full capacity, when full, it can hold at least 850. MedSup will confirm for us that detail. But as is right now, look at the door to the outpatient department. Naomba mnipe nafasi tafadhali, is that the door has actually been closed here. There was this particular bench which the nurses and clinical officers put to just show that no service is going on. This is right inside the outpatient department. However, even as this happens, look at the faces of frustration in the patients who are here. These are people who have been waiting for services as from 6 a.m. in the morning. And the saddest bit that they are saying, Brenda, is that while they come to this facility in the morning, while paying for consultation fee, no one tells them that actually there is no service being offered. Because when they go to pay, this is where, right behind me, is where the consultation fee is paid. And the process goes on as usual. You come, pay your consultation fee. No one tells you that there are no services being done. The NHIF office is also open. So if for those who are using NHIF, they are also not told that no service is happening. But once they get in here, where they are supposed now to wait and see healthcare workers, is when they realize that something is amiss, that they actually are not going to get any services. Look at the door there. It has been closed, meaning no one is getting any service from here. And yes, Brenda, I have with me the medical superintendent. Yes, Brenda, I can hear you.
All right. As you talk to that medical, superintendent, kindly I'd like to know, now what are doctors doing, because doctors work very closely with the nurses.
Yes, so far I haven't been able to speak to any doctor. However, you can tell that they are overwhelmed because they are not able to do all these roles. Remember, clinical officers are the ones who do, and nurses rather, are the people who do the biggest chunk of work in health facilities. For instance, the Nakuru isolation ward only had one doctor. All the other support staff were actually clinical officers and nurses. So you can imagine, in a COVID-19 isolation center, there's only one healthcare worker who's a doctor, who's at work. All the rest have down their tools. Let me speak to Dr. Mboro, who is the medical superintendent. Also, I'll be speaking to Ben Arama, the secretary of the Kenya Union of Clinical Officers, to tell us the situation. Sir, thank you so much for speaking to us. He is still on phone, but however, this is how the situation looks like. Yes, he is done. Sir, thank you so much for speaking to us, and sorry for that ugly confrontation earlier on. But we can see the charged patients, the charged crowd and services not being offered at the facility. Yes, you're rightly putting it that this is not a PGH issue. It is an administrative issue by the ministry and the county government. Perhaps tell us, how is the situation? Of course, patients angry. How do you intend to go about this?
Thank you very much. My name is Dr. Mburu. I'm actually back from leave. My leave officially ends up tomorrow. That is on 8th. But of course, because of what we were expecting, I decided just to pop in and see what is happening. For sure, there has been a delay in terms of service delivery. Like you have said, there are patients who have been waiting. This hospital serves between 1,500 to 2,000 patients every day, outpatient. We have about 750 beds. We have about 850 patients in the wards. But definitely, there has been plans on how, in case of such an eventuality, things will be addressed. This hospital has different kind of cadres. We have people who are permanently and pensionably employed. Those are unionizable. They are members of certain unions, clinical officers and nurses. We also have people who are on county contract. Those ones are not unionizable. We are expected to be offering services by this cadre of people. There are people who are employed, clinical officers, nurses, other cadres by the hospital. They actually form the big chunk of the workers in this hospital. So even as we wait for the other issues to be resolved between the people who are working as clinical officers and nurses, and they are unionizable, and their employers, we are supposed and we expect to continue offering the services. And so as I'm coming back, I want to understand literally what has been happening and definitely be able to put things back to normal.
Sir, you are stating that there are those who are on contract who are supposed to be at work. Perhaps, what is the exact number? And you may want to break down the number of clinical officers on contract who should be at work, the number of nurses on contract who should also not be participating in this particular strike. And is that an assurance that these patients here will be getting services from this facility?
Definitely, about 50% of our nurses are on contract, county and hospital contract. 50% of our clinical officers, and probably more than that, they are also on contracts, various contracts. And so they don't belong to any union. And we expect them to be offering services. Definitely when such a thing happens, there are challenges, there are misunderstandings, but definitely after a short while things will be smoothed out and services will be received.
And what is the situation like in the wards, in the inpatient department? At least 800 patients when the ward is actually full. How is it right now? And of course, let me take this opportunity to also ask for your permission to even assess the situation in the wards after this.
Definitely the access to the ward and anywhere in this hospital, it's open for you. And definitely you're going to access and have a look on what is going on. But what we would like and we would ask is for you not to interfere with the essential services that we are offering, or not to go to places that you are not allowed to go, like the isolation centers. But having said that, definitely the work in the wards where most of the patients who are being attended to are on emergency service needs, though I have not received all the reports, I have not had any challenge. And it's good to understand that majority of the people who work in these wards, they are mainly medical officers and they are nurses. And definitely, like I said, more than 50% of the nurses working there are on contract. In the wards, you hardly see the clinical officers. The only clinical officers who you see are mainly the outpatient. The clinical officers in the ward are clinical officer interns. So definitely, they are the people who are supposed to offer clinical services. We expect things to be flowing smoothly.
All right. Thank you, sir. That is Dr. Mburu. He's the med sup here at the Nakuru County Referral Hospital. Talking about the situation, says that even if there is that strike, that services here should be ongoing because at least 50% of the staff here are on contracts, and that is why he says that he actually wonders why patients are not being taken care of. And that is the situation, Brenda. Even as he says 50% of the staff here are on contract and should be at work, look at the people behind me, the people I'm about to speak to right now who are saying that they have been waiting for so long for services here. Look at this kind of person who's a patient involved, I'm told, in an accident. I don't know if they're able to talk to us, waiting in a facility whose doors, if Kim can show us, waiting in a facility whose doors have been closed. Remember, all this at a time when talks have always been hitting a dead end. Yesterday, we saw them, doctors actually calling off their strike or suspending their strike for 2 weeks. But we spoke on KTN News with the Clinical Officers Union Chairman, Peterson Wachira, who said that they will not suspend theirs because this was the third time that they were issuing such a strike. Ma'am, naomba kama utakuruhusu nizungumze nawe, wewe ndio uko na mgonjwa, tueleze jina lako, tueleze nini lilifanyika, mlikuja hapa saa ngapi?
Nilikuja 6 kama ijafika na nimetafuta gari ndio nipate kuingisha mtoto hospitali, lakini nilichukuliwa pale, lakini sijaona daktari. Sasa ninashindwa vyenye nitafanya.
Unasema ulifika hapa saa 12. Nini kilifanyika ndio mtoto akaumia? Mtoto
aligongwa kutoka Remuru na gari. Sasa vyenye alifungwa, hiyo mguu iko na uchungu zaidi, na ninataka niangaliliwe vizuri kama ni chuma itawekwa ama ni vipi vitafanyika. Sasa sijaona huduma. Na nimefikiria afadhali wangeniambia hakuna huduma, nipate huduma pahali pengine.
Na unasema kwamba haukuambia pale wakati ulifika zile pesa za kawaida, consultation fee na mambo kama hayo walichukua?
Wameshachukua na receipt nimeweka kwa bag juu sijapata huduma. Niko nafikiria kwenda nyumbani.
Unafikiria kwenda nyumbani? Pole sana ma'am, na naomba natumai kama alivyosema Dr. Mburu kwamba wale ambao wako hapa 50%, wale ambao wako kwa contract watakuwa wakishughulikia mgonjwa. But let me also speak to some other people, maybe people who have been waiting for services. Sir, karibu sana, uko katika KTN News. Nieleze jina lako, niambie ulikuja saa ngapi, kutafuta huduma ipi na imekuwa vipi?
Mimi ni Francis Adenga na mimi yani mgonjwa wangu amelazwa hapa. Tulikuwa nakuja kutoa damu. Na sasa tufanyaje? Kwa hayo maneno mtueleze venye na style, na kwanza mngatangazia pale nje ama mfunge gate. Yeah.
Kwa hivyo ulikuwa umekuja kutoa damu, umeshindwa kutoa damu?
Sijatolewa.
Alright. Yeah. Alright. Ma'am, na wewe tafadhali sekunde chache.
Jina langu ni Bethi Githenya. Mimi nilifika hapa saa 11, tukakata kadi saa 12 tukifikiria watatutibu, na sasa hatujatibiwa, mgomo inaendelea. Na sasa tunaomba serikali ya Kenya hata isitishe hii mambo ya BBI, tushughulikiwe sisi wananchi wa kawaida. Sisi watu wa chini ni kama hatunaga mwenyewe Kenya hii. Kama hiyo mambo ya BBI sisi hatujui, sisi tunajua hali ya mili yetu. At least sisi tusimame na mili. Hatutaki serikali tuangalie mambo ingine, kama ishughulikie sisi mambo ya BBI tuweke kando kwanza, ishughulikie madaktari sababu tumeamkia na hakuna kitu inaendelea.
Ma'am, pengine ukitoka hapa, iwapo hautapata huduma, utakuwa ukielekea katika private hospital, una huo uwezo wa kwenda katika private hospital?
Sasa shida yangu ni kwamba sasa hata private unaenda unaitishwa pesa. Kama ni mambo ya serikali kama hii vile tumekusanyika hapa, COVID iko na ukisema NHIF unaambiwa haitakulipia sababu serikali hawana pesa. Sasa je, sisi wananchi wa kawaida tuko wapi? Private hatutaweza kwenda. NHIF haisimamii COVID. Sisi hii NHIF ilikuwa tukate ndio ni sababu ya dharura, kwamba wakati ugonjwa unakuja unatibiwa. Sasa wakati wa COVID hautibiwi. Sasa NHIF ni ya nini?
Asante. Naomba niachie hapo, ila Brenda, you have seen how the situation is. I don't know where Ben Arama has gone to. Ben Arama is a branch secretary of the Kenya Union of Clinical Officers here in Nakuru County. He was to speak to us. He told us that the members here have down their tools. They are not going back to work. Remember, the issues that they are talking about include provision of PPEs, include also health insurance for those doctors or medical, rather actually healthcare workers who are in the front line in this battle against COVID-19. Remember, since the onset of coronavirus, at least 32 healthcare workers have lost their lives across the country due to this particular virus, and the situation is dire. Let's look at the officers concerned and see whether the solution will be found before it even becomes worse. Remember, we have seen such strikes before, but this is even worse considering the kind of pandemic that the country is having to deal with currently. Brenda.
Ibrahim Karanja, on that note, I'd like to say asante sana. I know when you get a hold of Ben Arama, he'll be giving us that live interview. But then, from Ibrahim Karanja, I'd like us to cruise over to Emmanuel too, who is at Kenyatta National Hospital at Clinic Hall.